Hi there, my name is Reagan, and I will be sharing my presentation on electronic health record software solutions. The purpose of this presentation is to provide the strategic leadership team with a well-researched evaluation of 5 potential EHR vendors with a detailed vendor profiling and a final recommendation for upgrading our facility's current system. Upgrading our EHR is critical to optimize clinical documentation, streamline workflows, enable secure data exchange across care settings, and support long-term organizational goals for quality, safety, and interoperability. Project overview. The procurement project aims to identify an EHR solution that meets our clinical, administrative, and compliance needs while offering scalability, data exchange, and future readiness. As part of a thorough needs assessment, the selected system should support inpatient and outpatient care, integrate with ancillary services such as lab, imaging, pharmacy, enable analytics, and provide tools for population health and patient engagement. The desired outcomes include improved documentation quality, enhanced care coordination, efficient billing and revenue cycle management, and improved access to actionable clinical and operational data. Going through our vendor selection criteria, we selected these 5 vendors for review based on a combination of clinical functionality, interoperability capabilities, vendor stability and reputation, total cost of ownership, user experience, and long-term viability. Additionally, we evaluated each vendor's capacity for comprehensive integration, support for analytics, security and compliance, customization, flexibility, training and support services, and responsiveness to formal procurement requirements such as RFP deliverables. So, going through each of these 5 vendors, starting first with Epic Systems, on our top left, this provides an integrated EHR with strong interoperability, robust analytics, and superior usability ratings. It's known for comprehensive modules across inpatient and outpatient settings and is quite common in many hospitals. Another popular vendor is Cerner to the right of Epic. Also with the system is with Oracle Health. They offer cloud-enabled technologies, strong clinical decision support, and extensive population health tools. Moving to vendor 3, it's going to be in the middle between the two, is Meditech Expanse. This is a web-based design with intuitive interface and cost-effective pricing, which is suitable for medium-sized organizations. Moving to vendor 4 on our left, we have Allscripts. This vendor provides an open architecture system with strong customization and integration capabilities. And then last, we have NextGen on our right. This system is designed for ambulatory settings, offering strong revenue cycle tools, configurable templates, and patient engagement features. Moving to our RFP key criteria, when drafting the RFP or request for proposal, we require vendors to provide a full description of clinical functionality, order entry, medication management, documentation, decision support, and specialty-specific workflows. Evidence of interoperability capabilities include data exchange across internal and external providers, support for the standards such as HL7, FHIR, and APIs, and patient data exchange frameworks. Analytics, reporting, and population health tools, which enable quality measurement, outcome tracking, registry management, and operational dashboards. Patient engagement tools and administrative modules. This includes patient portals, scheduling, telehealth or remote care, billing and revenue cycle management, referral or authorization workflows, and claims processing. Lastly, implementation support, vendor provided training, project management, migration plan, timeline, customization support, ongoing maintenance, and updates. Next, moving to security, compliance. Data governance and system reliability are important to have in the request for proposal. Lastly, total cost of ownership. This is going to be everything from the licenses, hosting, support, upgrades, training, maintenance, and potential customization for add-ons. All of these criteria align with both healthcare IT best practices and procurement standards to ensure that the vendor proposals are appropriate and able to be comparable to one another. Moving to the selection and evaluation process, we propose a stage procurement process. So this will start with a needs assessment to document the hospital's current workflows, integration needs, and future growth requirements. It's optional to issue a request for information or RFI to broadly survey vendor capabilities and suitability. We then would shortlist vendors based on this preliminary assessment. Next, issuing a formal request for proposal to shortlist the vendors with detailed requirements. Then establishing a evaluation to align criteria and score the vendor proposals. This will then lead to top candidates who will conduct vendor demonstrations, reference checks, and possible site visits or benchmarking to see user experience. Next is involving stakeholders across care teams, gather feedback on the usability, workflow fit, and support needs with the EHR. Lastly, for leading candidates, proceeding to pricing negotiations or request for quotation, also known as RFQ, to finalize total costs, contract terms, service level agreements, data governance, support, and implementation commitments. This structured, transparent process is important to help ensure thorough evaluation and alignment with strategic goals. Moving to ratings and feedback, beyond vendor proposals, we should supplement evaluation with data from peer institutions using each candidate's EHR. For example, assessing how the system performs in live environments regarding usability, support responsiveness, system stability, and real-world workflow integration is important. Getting user feedback from clinicians, administrative staff, IT teams can help inform our decisions, especially about training needs, customization complexities, and long-term maintenance demands that might not be seen in the initial introduction of the EHR. For a vendor such as Epic Systems, reviewing their widespread adoption, multi-setting implementations, interoperability performance, and user satisfaction across similarly sized and structured health systems provides valuable benchmarking data for our decision. Next, moving to pricing models and contractual details. Vendor proposals, they must include a complete cost breakdown. This can include licensing or subscription fees, onboarding costs, training costs, data mitigation, ongoing maintenance, support, upgrades, termination or renewal fees, and a plethora of many more within the cost breakdown. This is important to ensure long-term sustainability with the EHR and avoid hidden costs. Based on all of this data and the evaluation of the 5 different vendors, Epic Systems was given our recommendation as the best vendor. It's comprehensive, fully integrated EHR with spanning clinical care, administrative, financial, analytics, population health, patient engagement, and interoperability. It aligns strongly with strategic goals of scalability, quality, integration, and long-term value. Given Epic's track record and infrastructure, it's the most strategic choice for long-term EHR that can support a facility's growth and evolving needs. Proceeding with Epic would involve entering detailed contract negotiation or an RFQ to finalize pricing and implementation parameters. And here are my references. Thank you.